Shagun Aggarwal. I'm a specialist plastic surgeon here at the Sydney Adventist Hospital, and I also work at RPA and Prince of Wales. When they first make contact with, say, rooms with a plastic surgeon or with my rooms, what we usually do is we always say that, look, this is an information gathering stage, so we always see them at least twice before any planned surgery. So the first consultation will be, spending an hour or so talking to them about all the different options of reconstruction. Because when we talk to them on the phone, we don't know what they're going to be a candidate for. So it's to get their history, what their other medical history are, have they had radiation, what sort of a body type are they, is it going to be on one or two sides? And also in some ways how young they are and if they've had kids and if that is in the future. It just gives us an idea of what sort of reconstruction they may be suitable for, and also if or not they'll be suitable for their own tissue transfer. So at the time of consultation, I do spend at least an hour with my patients for the first time, and I talk to them about all the options that they would be suitable for. And sometimes we find they're suitable for all of the options, which might be an implant-based reconstruction as well as their own tissue transfer. We talk about those. We go through some photographs of patients who've had them in the past. If they do want, they can have some contact details of people to contact so that they get an idea of what that's like. And part of that talking process is also about things to expect during and afterwards. So let's talk about the ones that are during. So, so the woman who's opted for their own tissue transfer, I warn them that it's sort of, you do pay the price of having what is an excellent reconstruction really at the start. So by that I mean it's a long procedure, it can be 6 to 8 hours. And that's, once you come out of that anesthetic, you do feel quite exhausted and quite tired. Your back is up, your legs are up, and that's because usually we've taken tissue from the tummy. And the first 2 to 3 days, we spend closely monitoring the tissue that we've transferred. So nursing staff will check on the patient every hour, and I warn them that beforehand, they should just get as much sleep as they possibly can, because if you imagine having someone disturb you every hour for 2 to 3 days, you're going to be pretty tired by the end of it. Here at the Sydney Adventist Hospital, I usually send them to the intensive care, not because they're so sick, but it's just because the nursing staff are so great at that in the intensive care department. Once they come out of that, while they're there, they'll actually rapidly improve. So the first day, they'll largely be in bed, they won't want to do too much. But the second day, we get them up and about. They'll be walking just sort of a bit bent over because their tummy will be tight, and they get a lot of assistance with walking, but we want them up because I think that's key to getting recovery quickly. We slowly remove things that are connected to them, drips, drains, things like that. After 3 days, they'll be on the ward. And on the ward, it's really just an individual thing, but I usually tell people that, look, you'll probably be here for about a week in general. And in that week, you do go from someone who didn't want to do anything to, I really need to get home and I really feel normal and I want to get home. I do then, after they've gone home at about the 7-day mark, I usually see them every week in my office. And that could be just for things like there might be a drain that's still there, and then we can remove that. We look at all the wounds and the dressings, but usually there's not much to do from that perspective. But I think it's just reassuring for them that there's someone there just in case if there was any issues, that's sorted. I usually do tell them that it takes probably about 6 to 8 weeks for them to recover completely. And that's really just from the tummy aspect. It's almost like, when we dissect the muscles in the tummy, it's like you're having a ligament or a bone repaired. And that's the analogy I use. It just takes that much time for those areas to heal. So they'll feel, I don't let them, do any heavy lifting in that time. And I just say that they'll take you that long to feel normal. And at that stage, people will be doing most things. They'll be going to work, they'll be driving, they'll start doing some lifting. There shouldn't be any wounds or anything at that stage, and they start feeling pretty normal. After that, we tend to just space out the follow-ups every 4 weeks or so. And once they start getting to about a 3 or a 4 month mark, we start talking about the next stage if they're interested. And that's usually, a nipple reconstruction on one or both sides. So all in all, I think that's but once that process is completed, I say to everyone, I would like to see you once a year, and it's more for just seeing how things mature and change and any issues that may come up. But, if people don't want to do that, I say, look, fine, come every couple of years. I think it's, it's a very nice process where all the effort is at the start, and then after that, the patient have got their own reconstruction and it's for life. On the other side, if someone's having an implant reconstruction, it depends on if they're having it at the time of their breast cancer operation. So if they're having it at the time of their breast cancer operation, I usually just deal in conjunction with the breast surgeon in terms of timing and what sort of surgery they'll need. But at that time, we do again try and see them a couple of times. So the first 1 hour consult, a second time just to make sure we're on the same page, sign the paperwork. In the operation, we tag team with the breast surgeon. So the breast surgeon will be the one removing the breast and the breast cancer. And they usually, in general, leave the skin of the breast behind, which is a real advantage for us as plastic surgeons to then recreate the breast. And what we will then do is lift their pec major muscle, which is a muscle that lives on the chest, and underneath we'll put in a temporary implant called an expander or the permanent implant. Once we do that, we close everything with drains, and that person usually recovers very quickly because everything's located in their chest, so they can walk pretty much straight away. They feel normal. There's no real restrictions in terms of activity as such. The only restriction is upper body work, so we don't want them to do that for about 6 weeks. That's because that will try and move the implants that have been placed. They're usually, again, in hospital probably for the first few days, maybe 3, 4, 5 days. They often will go home with some drains, and again, I'll see them every week. But I do find that people recover from that a lot quicker because the location of surgery is being restricted. Once they see me in my office, if they've had a temporary expander, I usually then put in some more fluid to make that to the normal size and stretch the skin out. And then we'll talk to them at about a 2-3 month mark to change their implants for their final implant stage. If they've had their main implants put in at the time of the surgery, well, they don't need that, but we might do some touch-ups or do the nipple reconstruction down the track. For the implant patient, I do closely follow them long term. I do say it's mandatory for them to come and see me at least every 1 year, and that's just to look at what the implants are doing. You know, I think implants have come leaps and bounds. They're very good quality. We do still say that they last 10 to 15 years. I think that they do last a lot longer than that, but I still, as the person who's put them in, want to make sure that they're right. You know, there's no rotation, there's no rippling, there's no rupture. And if there's any signs at the 10 to 15 year mark that there's a compromise of an implant, we'll get some imaging like an ultrasound or an MRI, and if there's any suggestions, we'll offer an implant exchange. So I think for that category, absolutely imperative that they see me long term.